Morning. Thank you for giving me an opportunity to be here today. Tobacco Free Futures is a social enterprise. Our mission is to make smoking history for children and young people. How we do that, though, is about supporting adults to quit. Changing children's behaviour will be about reducing adult smoking prevalence, changing smoking in the communities where they're growing up and breaking that intergenerational cycle of smoking that we see in our poorest communities in particular. And we believe that e-cigarettes will have a real role to play in that. So in May this year, we were commissioned by Public Health England in Greater Manchester to run a workshop with practitioners, local stop smoking service practitioners, to understand their views, their beliefs, their experiences and concerns around e-cigarettes, and to help to support them to understand some of the evidence better, to consider how we might be able to address some of the barriers that they might have to working with those users who might be coming into their services who were coming along and saying, I'm using an e-cigarette to quit smoking. And we wanted to inform the development of a guidance resource, and we had 44 local stop smoking service practitioners come into the day, mainly from Greater Manchester, but also from across the northwest. So the format of the day included an online survey that we sent out that was a quantitative methodology to ascertain their perceptions before they arrived on the day. We also had a number of focus groups that took place on the day with between 5 to 8 people in each group to gain a more in-depth qualitative understanding of their perceptions, to understand how they were gaining their information around e-cigarettes. And actually, just picking up on the point that was just made earlier in the audience, practitioners were just as likely to be gaining their information from the media as from evidence reviews. We wanted also to provide some expert presentation and discussion into the day. We then repeated the online survey that we'd done with practitioners, and we had an Ask the Expert discussion to give them some opportunity to have some one-to-one discussion with the experts that were present on the day. And we then presented the top-line findings back to them. So the presenters who were there on the day included Anne, who's here today, and myself, and a range of people who were then providing some real detailed evidence and providing some of that information that could help them to understand better why e-cigarettes might be quite useful to those people who are coming into their services, and to help them to have that more in-depth understanding. So in terms of the results, what we found from the pre-survey was that the majority perhaps did feel quite underinformed, that there was a real level of confusion, a real level of ambivalence perhaps of e-cigarettes as a quit aid for those people who were coming into their services. And in fact, perhaps few of them were working with e-cigarettes as part of their service offer to clients in a formal way. And that's because e-cigarettes really weren't part of the local delivery specifications in the majority of North West services at that time. And therefore, there was quite limited scope to discern the experiences of effective or ineffective use of e-cigarettes as a quit aid. There were also widespread concerns amongst practitioners about the long-term health impacts of e-cigarettes, around the evidence around that. Also concerns about the efficacy of e-cigarettes as a quit aid, a real lack of understanding of the evidence around that. There were concerns about the renormalisation of smoking, concerns about the appeal of e-cigarettes to children and young people, and there was a general concern about the impact that e-cigarettes might be having on the footfall of their services. In terms of the focus group work, there were 7 focus groups carried out on the day, and we talked to them about how they believed e-cigarettes might be more useful as a quit aid. And the focus group participants were clear that they needed to have a better evidence base to communicate the safety and efficacy of e-cigarettes to the people who were coming into their services, and that promoting the local stop smoking service offer of support and advice alongside the use of e-cigarettes would make them more useful as a quit aid. And certainly I think the Public Health England evidence review, that's addressed this in a very concrete way. Public Health England has very clearly advocated the use of e-cigarettes as an offer of support within local stop smoking services. And certainly on the day that the guidance was published, I spent a lot of time talking to the media about the offer that local stop smoking services could make to e-cigarette users in a really positive way, and being able to promote that. So I think that certainly at the time that this was happening, that wasn't there, but now that is really there for those local stop smoking services, and that was one of the really clear asks that was there on the day. In terms of the feelings that local stop smoking service practitioners had, the concerns that were there were about issues like tobacco industry involvement in e-cigarettes, and there was also a concern about stop smoking services per se, about how footfall was falling, how they could get more people into stop smoking services, and there was also that view there that there was a potential to feel really positive about e-cigarettes once products were licensed, as there was more evidence available about e-cigarettes, and as those licensed products became available, and if there was clearer evidence about the potential of e-cigarettes to reduce inequalities, if there was clearer evidence that e-cigarettes were products that were able to address the needs of communities that were not generally quitting, there was a feeling amongst local stop smoking service practitioners that this could be something that would really help them in a way that they hadn't been able to previously, to address the needs of groups like mental health service users, to address the needs of other groups like prisoners perhaps, who were groups that they previously found it hard to reach and support the needs of. So in terms of the post-survey workshops, we asked them after the presentations, again through an online survey that they went away and took some time to fill in, how well informed they felt after the presentations. And you can see that there was a significant change in how well informed people were feeling after the workshops. And in terms of how effective e-cigarettes were, there was also a change after the information that people were given in terms of how effective e-cigarettes were to people. I think the most significant change, though, was in how keen people were to promote e-cigarettes as a quit aid. And that was a really positive thing that did come out of the day. Certainly at the beginning of the day, around 60% of the practitioners prior to coming to the event were not keen to promote e-cigarettes to their service users and to their local communities, whereas afterwards 80% felt confident that they would be willing to promote e-cigarettes as a quit aid, and that was something that does provide some confidence that now that we do have an evidence review and now that we do certainly have a number of things in place that we can use to support those local stop smoking service practitioners, we can move forward. So it did reveal an increased understanding of the current evidence base, a greater level of support for offering e-cigarettes as one of a range of quit aids, but with that strong proviso that we needed more information and guidance. We have done some further work with e-cigarette service users, and we have seen things that you would expect to see in terms of the role of e-cigarettes in quitting, and we wanted to understand what e-cigarette users would see as their ideal stop smoking service, and One of the things that I would say when we look at this is that this looks very, very different from the stop smoking services that we currently provide. So e-cigarette users wanted to be able to look at product sampling, a guide to types of products, a range of types of products available. They wanted some quality assurance, which of course, licensing would provide some of that. They wanted advice on the pros and cons of different types of products, but that wasn't against the other types of quittes that were available. And in terms of this issue of whether e-cigarettes should be available on prescription, the debate we had in the focus groups that we ran, there was really no consensus on this, and it really wasn't a deal breaker either way. In some ways, there was a discussion about, yes, perhaps there should be parity with other NRT products, and it might enable people to buy better quality e-cigarettes. But there was also a real debate about personalisation and choice, and this was really, really important to people, probably more important than being able to have something on prescription. So in terms of conclusion, certainly the express need of practitioners was for evidence at that time in May, but certainly there is very much more evidence now. I think that has been addressed through the guidance that's come from Public Health England. Tobacco-Free Futures with PHE Northwest is publishing some guidance next week. The guidance from CRUK and PHE through the Electronic Cigarette Research Forum and the publications that come out through bulletins regularly are very, very much appreciated through the field, interpreting the evidence that is coming out on a regular basis. And the NCSCT guidance and training that's being reviewed at the moment also is very much valued by the field. Thank you.
Time for questions, so hands up please. So I'll hand over here. Do you want to shout? Where are the microphones?
Yeah, Farrell Delman, TMA. Thank you very much, Andrea, for your presentation. I'm wondering if during the focus group sessions with the practitioners, you had an opportunity to understand what they would consider to be adequate evidence. So much of the discussions about cigarettes are built on decades of epidemiological data. And I'm wondering whether the practitioners would want decades of epidemiological data on e-cigarettes to feel comfortable about the relative health effects, or whether they would be satisfied with other types of data that could be delivered scientifically. Did you have any sense of what they were looking for as a evidence basis?
So, I mean, they were concerned, they expressed concerns about the long-term impacts of e-cigarettes, and clearly we don't have decades of data on e-cigarettes, but we do have some data on NRT that we have decades of data on. And there was, I think the PHE evidence review has addressed many of their concerns. And so I think, obviously we will need to build evidence over a period of time about e-cigarettes. And there is a recognition that there is a willingness to do that.
Thank you. And I just saw one question here at the front.
Thanks. David Abrams from Johns Hopkins University School of Public Health. I'm intrigued by the medication versus no medication perception label. And I'm just wondering if you have some thoughts about that, because to me, from a psychological point of view, it has to do with empowerment and self-efficacy. And in that sense, some people, smokers who are having trouble quitting, may have a much stronger attribution that they did it themselves on their own with the exact same product if it's not labeled or perceived as a medication. Whereas others might say, I need some help and this medication is a strong alternative. So there could be huge individual differences, but I'm wondering about capitalizing on both of those with the goal of empowerment and confidence to persist until you quit either way.
I mean, I think that's a really interesting perspective and point. And of course, having sat in focus groups with people who are using e-cigarettes to quit and haven't, you know, the majority of people who were in the focus groups that I was involved in, well, none of them had used services as part of their quit attempts. They'd used their e-cigarettes, they'd either already quit or were involved in a quit attempt and did feel really empowered. The idea of using a service as part of that was appealing to some people and provided an additional attractive offer for other people. They did feel entirely empowered to you know, continue to use their e-cigarette and were happy with that choice. But you know, for many of the people in the groups I attended, many of them had other health problems and were very much users of NHS services, and the idea of another service that might support them in their quit attempt because they were actually quite sick because of their tobacco use was something that was very appealing. So they were already medicalised because of, you know, their tobacco use.
Okay, well, thank you very much, Andrew. We're to draw that to a
Thank
halt
you.
now. Thank you.